Taurine, which is a fascinating molecule, has received a lot of attention due to its health benefits. So in this video, we are going to discuss what is taurine, what are the health benefits of taurine, and whether should you start taking taurine supplementation or not. Let me know your thoughts on taurine supplementation by the end of this video. Taurine is the most abundant intracellular amino acid in our bodies. As we know, amino acids are the building blocks for protein. However, when it comes to taurine, taurine mainly exists in a free form and it's not part of any protein in our bodies. Our liver has the ability to produce taurine from other amino acids, primarily methionine and cysteine in our bodies. And our kidney is the main regulator of taurine concentration in our body, which means if you are not taking enough dietary taurine, your kidney will decrease taurine excretion and increase its reabsorption into the circulation. However, if you are taking high dietary taurine, or if you are in a tricky conditions like surgery, muscle damage, or radiation therapy, these scenarios can lead to an increase in its excretion through kidney. Now that we understand what taurine is, let's talk about the health benefits of taurine. Taurine plays an important role in numerous biological and physiological functions in our bodies. Various studies, both in human and animal models, have been conducted to understand its health benefits. Let's discuss taurine's health benefits starting from its antioxidant properties. Our bodies produce reactive oxygen species that cause oxidative stress. Oxidative stress is a well-known risk factor for various metabolic diseases. On the other hand, antioxidants decrease reactive oxygen species and oxidative stress that reduce the risk of metabolic diseases. Taurine has been shown to have antioxidant activities that reduces oxidative stress. As a result of its antioxidant properties, taurine decreases the risk of developing metabolic diseases. Next, the anti-inflammatory properties of taurine have been studied extensively in animal and human subjects. Similar findings were found in both types of studies that taurine have an anti-inflammatory properties. One of the studies reported that taking 500 milligrams of taurine 3 times per day for 12 weeks helped patients with heart failure to have reduced inflammation before and after exercise. Lowering blood lipids is another health benefit of taurine in our bodies. This has been shown in several studies. The improvement in hypercholesterolemia is due to several mechanisms that include the conversion of cholesterol to bile acids, promoting bile acids excretion through feces, enhancing cholesterol clearance from the bloodstream, inhibiting bile acids absorption in intestine, and reducing very low density lipoprotein secretion from the liver. Next, improving blood pressure, which has been shown in animal and human studies that taurine supplementation can reduce blood pressure. This reduction in blood pressure is due to suppressing renin-angiotensin-aldosterone system, dilating blood vessels, and inhibiting sympathetic nerve activity. Preventing obesity, which a lot of people around the world are suffering from, is another benefit of taurine. Taurine prevents obesity primarily through 3 mechanisms. First, increasing energy expenditure by enhancing factors involved in fatty acid oxidation. Next, decreasing lipogenesis by reducing postprandial glucose oxidation. And finally, modifying the energy ratio used for glycogen synthesis and lipogenesis. Next, diabetes. Numerous studies have determined the beneficial effect of taurine supplementation on reducing the onset of diabetes and its associated complications. Taurine does all of these by improving insulin resistance, protection of pancreatic beta cells that produce insulin, promotion of insulin secretion, antioxidant effect, and anti-inflammatory effect. Taurine plays a crucial role in cardiovascular physiology. The cardiovascular benefit of taurine is based on improving vascular function, cardiac function, blood pressure, and blood lipids. Its antioxidant and anti-inflammatory properties also reduce the risk of cardiovascular diseases such as atherosclerosis and heart failure. This has been shown in several preclinical and clinical studies. Finally, aging. Levels of taurine have been shown to decline as we age. Therefore, it's suggested that the low level of taurine is associated with age-related diseases that negatively affect longevity. A recently published paper found that taurine supplementation increases the lifespan of model organisms. They also found that those mice that received taurine supplementation had improved muscle strength and they seemed healthier. After understanding all the beneficial effects of taurine, it's tempting to start taking taurine supplementation, right? So let's talk whether you should consider taking taurine supplementation or not. There are 3 things that are important that will help you to decide whether you should take taurine supplementation or not. First, are you consuming enough dietary taurine? Second, are you at risk of taurine deficiency? Third, what's your main purpose for taking taurine supplementation? Before discussing about each one of them, if you found this video helpful, don't forget to like and subscribe to learn on topics related to nutrition, health, disease prevention, and management. First, are you consuming enough dietary taurine? Taurine is present in high amounts in animal sources such as shellfish, red meat, organ meats, chicken, eggs, and many more. This table from a research paper shows the amount of taurine in various food groups. As you can see, seafoods are the best dietary sources of taurine. Do not forget that taurine is also added into energy drinks that contribute to taurine intake. However, this does not mean that you have to start consuming energy drink for the purpose of taurine intake. Second issue to consider before starting taurine supplementation is whether you are at risk of taurine deficiency or not, because those people who are at risk of taurine deficiency might benefit from its supplementation. Vegan and vegetarian are at risk for taurine deficiency due to the animal sources being the primary sources of taurine dietary intake. Therefore, taurine supplementation might be beneficial for vegans and vegetarians. However, no study have stated any negative health effects among vegans or vegetarians that's caused by taurine deficiency. Second, individuals with liver failure are at risk of taurine deficiency due to their inability to produce taurine endogenously. As we stated at the beginning, liver produces taurine in our body from other amino acids, primarily methionine and cysteine. This plays an important role in maintaining taurine concentration of the body. Third, people with kidney failure are at risk of taurine deficiency because kidney mainly regulates taurine concentration in our bodies. Therefore, people with kidney failure might benefit from taurine supplementations. Finally, people with vitamin B6 deficiency or precursor amino acids, mainly methionine and cysteine deficiencies, are at risk of taurine deficiency due to their role in endogenous production of taurine. The last and most important issue to consider before starting taurine supplementation is understanding your purpose for taking taurine supplements. If your purpose is to take taurine supplement for any of the health benefits, it's important to understand that the majority of studies that are conducted to see the health benefits of taurine are in animal models. In those studies that are conducted in humans, as you can see in this picture, are conducted among those people who have a specific disease or conditions, and the results from those diseases are not generalizable to everyone. Therefore, even if you consider taking taurine supplementation, the benefits might not be similar to the one we have talked about, because individual responses to dietary supplements can differ, and the appropriate dose for a person may depend on various factors such as age, gender, weight, and overall health status. If you are someone with any medical conditions, you have to consult with your medical doctor before considering taking taurine supplementation. This will help you to avoid its negative effects. Finally, it's important to understand that currently there are no established daily recommended amount to consume for taurine. It's generally believed that typical Western diet provides sufficient taurine for most people without the need for taurine supplementation. But it's also crucial to know that excessive consumption of taurine supplements may lead to potential side effects. These side effects include gastrointestinal disturbances and neurological symptoms. Thank you for watching, and don't forget to share your thoughts on taurine supplementation in the comment section of this video.